Good afternoon today. My name Dr. Santiago Laborde, consultant general and surgeon based in Ledme Health, Bokamoso Private Hospital, Gaborone, Botswana. Well, as a private doctor, more than 11 years in Botswana, I have been seeing a lot of obese people with different, we call comorbidity together with the obesity. Obesity just per se is the disease, meaning that is increase the probability and the risk of cardiovascular diseases, also cerebrovascular diseases, vascular disease per se, like for example, let's say varicose veins in the leg, they can produce ulcers in the leg, diabetes as well. And that's why we want to have the possibility to provide an instrument and a program where our population in Botswana that is very small, but the obesity is very frequent due to the bad alimentary habits. That's why we want to give this opportunity. Today we want to talk about the patient selections and certain key points in the medical evaluation for a placement of Orbera gastric balloon. First of all, we need to establish that you will be addressed for the multidisciplinary team, where we want to try to address all the possible comorbidities in this kind of issues. But the most important one is the one regarding to the gastrointestinal system. This gastrointestinal system is just to take the motility issues, meaning how our intestine, stomach, and everything is moving. Is like, for example, you have certain issues with the stomach is all the time paretic, meaning gastroparesis, meaning it's not moving properly, because you have certain chronic issues, for example, irritable bowel syndrome, nausea, vomiting sometimes, or you have problem with the swallowing, meaning there are certain swallowing disorders like achalasia, dysphagia, or another esophageal disease like a gastroesophageal reflux. Of course, to have all this kind of information give us the possibility to tell you are eligible or not. That's why we are saying, if you are eligible or not, don't make to this video to tell I'm eligible or I'm not. Just pay the visit and we will tell you if you are eligible or not, and will be benefit with this kind of program that will help you a lot with this kind of situation. Also, there are relevant blood tests that identify certain contraindications, like a renal function test, liver function test, clotting profile, that is very important for us. Also, certain, if you are taking any antithrombotic medication, like aspirin, clopidogrel gel, or something like that. But also to try to review all the type of medication that you are taking, but also the story of what kind of medication produce allergies to you. Because with this placement of this kind of Orbera balloon, you will take in pump proton inhibitors like people knows, like Nexium, omeprazole, lansoprazole, pantoprazole, all those kind of medications. But also we need to evaluate the risks that you have with the placement of the kind of stuff. And when you are eligible for this kind of situation, we need to determine after you are the placement of the gastric balloon, what kind of situation you be involved with this kind of placement, because the first or 2-3 weeks will be a very tough situation because it's a foreign body in our stomach and our body responds. But they are very well manageable symptoms like nausea, vomiting sometimes, epigastric pain, maybe cramps, that with the medication that we provide you, we will already proven that kind of stuff, we will help you a lot and you will not feel absolutely nothing. We have several patients already that we place the gastric balloon here in Bokamoso. We are talking about 12 patients. 2 of them already, they lost around 50% of the amount of pounds, no kilogram, pounds that they were supposed to lose. But they need to be a little bit more stricter regarding to diet and exercise. Because sometimes people think, I put the balloon, I don't need to do nothing. As I spoke before. It's not working that way. is not a miracle. Orbera gastric balloon is a combination of factors to try to reduce weight. It's a non-surgical procedure. Why? Because alone we will not help you at all. You need to do exercise, you need to do your diet, and to reduce the capacity of the stomach, the emptying of the stomach, to try to eat less. That doesn't mean only with a balloon will help you. People sometimes forget that it's a non-surgical procedure. In the time that is inside, already you waste your money, because gastric balloon is not paid by medical aid. It's paid for your pocket. But the rest of the consultation, the procedure is paid by your medical aid. It's not a problem, but the device need to be paid by yourself. Of course, if you want to know the cost and everything, please pay a visit to see if you are eligible or not. Don't think about it now. Just think how this kind of a program will help you regarding to your health. That's our first goal, is just to help you with your health, to try to reduce the weight that contribute to a lot of disease, to increase the mortality in our population. Of course, don't believe only in what I'm saying. Just you can review also the WhatsApp regarding to our product. Is Orbera Gastric Balloon 365, created by Apollo. Thank you so much. See you the next time. For us,